Welcome. In this video, we'll explore the comprehensive treatment plan for periodontal therapy. The main goal is to achieve total treatment, which means coordinating all procedures to create a well-functioning dentition within a healthy periodontal environment. Think of the treatment plan as a blueprint. It guides every step, ensuring nothing is missed and that the patient's oral health is restored systematically. Each phase builds on the previous one, so careful planning and logical sequencing are essential. Let's begin by understanding why a structured approach is crucial for successful periodontal outcomes. A treatment plan is more than just a checklist. It's a strategic guide that coordinates all necessary procedures to restore and maintain periodontal health. By mapping out each step in advance, clinicians can ensure that every aspect of the patient's condition is addressed, from emergency care to long-term maintenance. This approach not only improves outcomes, but also helps patients understand the journey ahead, building trust and cooperation throughout the process. Periodontal therapy follows a logical sequence, starting with emergency interventions and progressing through various phases. Each phase has specific objectives and procedures, ensuring that the patient's needs are met at every stage. This structured approach minimizes complications and maximizes the chances of long-term success. Let's break down each phase to see how they fit together. The first phase is the preliminary or emergency phase. Here, the focus is on addressing urgent issues that could threaten the patient's health or comfort. This includes treating dental or periapical abscesses, managing periodontal abscesses, and extracting hopeless teeth. If needed, provisional replacements are provided to maintain function and aesthetics. By resolving emergencies first, we create a stable foundation for subsequent therapy. Dental emergencies can be painful and potentially dangerous. Immediate treatment of dental or periapical abscesses is crucial to prevent the spread of infection. Similarly, periodontal abscesses require prompt attention. Extraction of teeth that cannot be saved is performed during this phase, and temporary replacements may be provided to help the patient function normally until definitive treatment can begin. Phase 1, also known as the Etiotropic Phase, targets the underlying causes of periodontal disease. The main focus is on controlling plaque and modifying the patient's diet to reduce risk factors. Calculus removal and root planing are performed to eliminate deposits and smooth root surfaces. Any synthetic or irrational factors contributing to disease are also addressed. Antimicrobial therapy may be used to further reduce bacterial load. Effective plaque control is the cornerstone of periodontal therapy. Patients are educated on proper brushing and flossing techniques, and dietary habits are reviewed to minimize factors that promote disease. By empowering patients to take charge of their oral hygiene, we lay the groundwork for successful treatment and long-term health. Removing calculus and performing root planing are essential steps in eliminating the bacterial reservoirs that drive periodontal disease. These procedures smooth the root surfaces, making it harder for plaque to accumulate and easier for the gums to heal. This phase also includes the removal of any synthetic or irrational factors that may be contributing to the disease process. In some cases, antimicrobial therapy is used to further reduce the bacterial load in the mouth. This may involve the use of mouth rinses, gels, or systemic antibiotics, depending on the severity of the infection. The goal is to create an environment where healing can occur and the risk of disease progression is minimized. Phase 2 is the surgical phase, where more advanced procedures are performed to correct underlying structural problems. This may include occlusal therapy to adjust the bite, minor orthodontic movement to reposition teeth, and provisional splinting to stabilize mobile teeth. Surgical interventions are carefully planned based on the patient's response to Phase 1 therapy. Before moving forward with surgical therapy, it's important to evaluate the patient's response to Phase 1. This includes rechecking for plaque, calculus, and caries. The results of this evaluation help determine whether surgical procedures are necessary and, if so, which ones will be most beneficial. Surgical procedures in periodontal therapy are designed to reduce or eliminate pockets, regenerate lost tissues, and improve aesthetics. Common procedures include gingivectomy, periodontal flap surgery, and regenerative techniques. Each procedure is selected based on the patient's unique needs and the extent of periodontal damage. Pocket reduction or elimination is a key goal in surgical periodontal therapy. Procedures like gingivectomy and flap surgery are used to access and clean deep periodontal pockets, making it easier for patients to maintain oral hygiene and for tissues to heal. Regenerative procedures may also be used to restore lost bone and connective tissue. Periodontal plastic surgery techniques are used to enhance the appearance and function of the gums. Procedures such as root coverage and connective tissue grafts help to widen the attached gingiva and improve aesthetics. These techniques are especially important for patients with significant gum recession or aesthetic concerns. Before placing prosthetic restorations, certain surgical procedures may be necessary to prepare the mouth. These include crown lengthening, ridge augmentation, and osseous surgeries. The goal is to create a stable and healthy foundation for future restorations, ensuring long-term success. Implant surgery is an advanced phase of periodontal therapy. Procedures such as guided bone regeneration, placement of dental implants, and sinus lift are performed to replace missing teeth and restore function. These surgeries require careful planning and precise execution for optimal results. After surgical procedures, a thorough reevaluation is essential. This step assesses healing, checks for complications, and determines whether additional treatment is needed. Regular follow-up ensures that the patient remains on track and that any issues are addressed promptly. Phase 3 focuses on restorative therapy. This includes placing final restorations such as crowns, bridges, or dentures, and ensuring that the prosthesis fits well and functions properly. A periodontal examination is performed to confirm that the tissues are healthy before finalizing the restorations. Reevaluation is also conducted to monitor progress. The maintenance phase is critical for long-term success. Patients are scheduled for periodic recall visits, during which plaque, calculus, and gingival conditions are checked. Occlusion, tooth mobility, and other pathologic changes are also monitored. Regular reevaluation helps catch problems early and maintain periodontal health. Reevaluation is a vital part of the treatment plan. Its objectives include assessing tissue response after therapy, checking for gingival inflammation, pocket depth, and tooth mobility. It also evaluates the patient's compliance with oral hygiene using plaque and bleeding indices. Based on these findings, further periodontal therapy can be planned if needed. To visualize the preferred sequence of periodontal therapy, let's look at a flow chart that outlines each phase, from emergency care to maintenance. This schematic helps both clinicians and patients understand the logical progression of treatment and the importance of each step in achieving periodontal health.